If you have not yet read all of the information below, please stop this video and spend the time reading through the regulations. It's required that we talk about these, and you also need to watch the videos about jurisprudence, risk management, boundary issues, those kind of things. But the Board of Chiropractic and Massage Therapy Examiners are required to have you watch this through the Department of Health and Mental Hygiene. So let's go over the Comar regulations. First section, 10.43.07.01. So what they're wanting us to talk about first are these terms. So you are referred to as an applicant. This is a person who's taking the training necessary to become a chiropractic assistant. Anytime these documents mention board, that refers to the Board of Chiropractic and Massage Therapy Examiners. Referring to a chiropractic assistant means somebody who has been registered by the board to perform the duties authorized in this chapter. The term direct supervision is supervision that's provided by a supervising chiropractor. Now, for a chiropractor to be a supervising chiropractor, there are specific regulations in the Comar guidelines that must be met for that individual to be a supervising chiropractor. So that's the first thing you need to make sure is that your chiropractor has supervising chiropractic status, which I'm sure they do, or they wouldn't be asking you to become a CA, but that is a requirement. So this is a supervising chiropractor, and in Maryland, that person must be personally present and immediately available in the area where the procedures are performed to give you aid, answer your questions, and give you instruction when certain procedures or activities are performed, and we'll get into that at the end. This supervising chiropractor term is somebody licensed by the Board of Chiropractic with the right to practice physical therapy. Now, that's referred to as physical therapy privileges, and that's under the Article 3-301 of the Annotated Code of Maryland. And that person must be approved as a supervising chiropractor by the board. So they're actually on their license, it has an S before the number, meaning supervisor status. The next section, 10.43.07.02, are the requirements for achieving this supervising chiropractor status. If you don't have the supervising status as a chiropractor, then you can't train a chiropractic assistant or work with chiropractic assistants. You have to have that status. Only an active licensed chiropractor with physical therapy privileges, as I said, and they also have to have no outstanding disciplinary orders by the board. Those people are the ones that can qualify for supervising chiropractor status. To be an applicant for supervising chiropractic status, you need to submit to the board the required application and fee. You must successfully pass the board supervising chiropractor examination and be interviewed, and you must satisfactorily follow the board regulations and statutes. So the board can deny, suspend, or revoke that status, that supervising status, if the individual chiropractor violates the board's statutes or the regulations. Responsibilities as a supervising chiropractor. This is 10.43.07.03. As a supervising chiropractor, that chiropractor will submit to the board the required request to employ. It's a form there's a link to that in this course before undertaking any hands-on training or coursework with any chiropractic assistant applicant. Also, all other board required reports and forms must be submitted in a timely manner as outlined by the board, and that supervising chiropractor must notify the board and course instructor or instructors of any change in status of any chiropractic applicant or assistant within 10 days of the change. Now, these are things that would change. Reasons for this change in status. Why are you dropping out of the class, or maybe you're moving out of the country or moving to some other state, or just taking another job, or you decided you don't want to work in the chiropractic office anymore. You also have to notify of any change in status of any training received by the applicant or assistant, the hours completed by the applicant or assistant, and the applicant or assistant's forwarding address. Also, you must maintain accurate, legible, and comprehensive records of all clinical training provided to the chiropractic applicant or assistant. And that includes, but isn't limited to, the dates and times and duration of training that's described in Regulation .05 that we'll go over. Now, here's the thing. That form that you have to fill out to keep track of your training, don't wait till the last day and then try to guess. That's not the way to do it. What you want to do is every day in the office, write down what you did, what you observed, what you were helping with, and the time that you were doing this, and then have your doctor give it an initial. Was it satisfactory or was it unsatisfactory? And also sign it. So you want to do that day by day as you're working and building your hours in the office. Also, you want to have records of the modalities. That's what I'm saying. Make notes of what you did. Number 3, the equipment you used. Did you use the cervical traction unit? Did you use the ultrasound? Did you do electrical stim in combination with ultrasound? Diathermy, whatever it was you were doing, put that on there. And any other information that may be directed by the board. You also have to be able to immediately produce the records as described in this regulation if you're audited or the board requests them. So that's why you don't want to wait till the end to try to do this. Do it as you go so that the records are always available. The next thing, Section E, promptly, number 1, report a chiropractic applicant or assistant who's not making satisfactory training progress. So try to do a little bit of your training every week. Watch, 3 or 4 hours of slide work and class work. Watch the videos and keep up with that. Keep your documentation up. You also want to promptly report as a supervising chiropractor to the board as directed regarding the details of the training program issue if there is an issue. The person left, person quit, person's no longer showing up. F, maintain competency and knowledge of all the laws and regulations and successfully complete any jurisprudence requirements as directed by the board. Well, that's what you're doing right now. G, ensure that all patient records accurately and legibly reflect the extent and degree of the involvement or assistance of the chiropractic applicant or assistant. H, you need to submit the in-service training hours and the verification of chiropractic applicant or assistant competency on that form that's provided by the board. Like I said, you'll be able to download that. There's a link in the course to download your forms, and that's on the first section. So go there, make sure you've done that, and printed out your forms, and you want to get those in within 30 days of completion of training or transfer. So that means let's say you do half of your training, you work for your chiropractor for 2 months, and you have not yet finished training, and chiropractor across town sees you, you know him or her, and she says, listen, I'd like to offer you a job, which isn't really the best, maybe not be the most ethical thing to do, but maybe that doctor knows now you're taking, and he says, hey, I'll give you $2 more an hour to come work for me. Well, or she says, come work for me, I'll give you $2 more an hour, whatever, 2 weeks vacation. You go, oh, that'd be great. So you leave who you're training with and you've not yet passed the test, and you start working for, Dr. Jane Smith across town. Then you need to submit your instructor, and you need to submit notification to your instructor and also to the board. Also, you need to be fully responsible for the safe and competent performance of the chiropractic applicant or assistant at all times as the supervising chiropractor. And also, you need to provide direct supervision to not more than 5 chiropractic assistants or applicants at any one time. Section 10.43.07.04. These are prohibited acts as the supervising chiropractor. Supervising chiropractor may not delegate responsibility in any manner to anyone not holding supervising chiropractor status. So what this means is, let's say that you're training under Dr. Jane Smith, and she's going to go on vacation for 2 weeks, and she brings in a covering doctor, and that covering doctor does not have supervising status. What that means is that no acts under the Chiropractic Act can be performed. So no therapy can be performed, no inpatient intake, nothing that requires you to be a licensed chiropractic assistant or training to be a licensed chiropractic assistant. So if somebody comes in and covers for your doctor, you want to make sure that that doctor that's covering has supervising status so that you can do what you need to do. Also, the supervising chiropractor cannot leave the treatment area when A, they're treating a patient, or if a chiropractic applicant or assistant is treating a patient. So what that means is that, let's say you have two people on electrical stim and it's 5 o'clock and the office closes at 5, and these people just got started on their electrical stim. So they're on electrical stim and you see the doctor putting on his coat and heading out the door. Well, he cannot leave the office until that last patient is finished being treated. All right, so that's the way the statute is. If the person's still getting electrical stim, they need to be in the office. If they leave and they walk out the door and the person's still on stim, then you need to turn that off immediately and discontinue the treatment. Also, number 3, a supervising chiropractor cannot permit a chiropractic applicant or assistant to treat a patient without the presence of the supervising chiropractor in the treatment area. Now that means the treatment area is the office. But he cannot be across the street at the gym while you're treating the chiropractic patient. B, the license of a licensee who violates this regulation will be subject to penalties as set forth in Comar 10.43.10. The chiropractic assistant or assistant qualifications and training, section 10.43.07.05. A, when you are hired and being trained as an applicant, now we're talking about stuff that applies directly to you. This section is regarding your training. You have to be 18 years of age or older. You have to be of good moral character. You must be a U.S. citizen or hold federal documentation authorizing employment. You must be proficient in the English language sufficiently to allow for clear interaction with your patients. You must be enrolled in a board-approved CPR class or be currently CPR certified. You also must be a graduate of a high school or hold a GED. And number 7, you must have any foreign transcripts professionally interpreted and certified before you submit them to the board for review. The supervising chiropractor, section B here, shall complete and submit to the board a legible application and documentation proving that the applicant meets the qualification listed in this regulation. C, an applicant may not commence work. You cannot begin your training until the supervising chiropractor gets that authorization letter from the Board of Chiropractic. So before you start doing any training, it will not count. Don't put any dates on your observation hours because they do not count until that letter is received from the board. Now you have 120 days from the date you're hired to do these things. Number 1, you must complete the CPR course. And number 2, you must enroll in a board-approved chiropractic assistant 103-hour course of instruction. Well, you're in that right now. So if you've paid your money, you've taken care of number 2. And number 3, you must submit proof of completion of both of these requirements in a timely manner. So you have 120 days to do it, and if you finish it on day 120, a timely manner is up to really interpretation by the board, but basically you have, get it to them within 2 weeks and you'll be fine. E, within a calendar year of the date of hire, the applicant shall satisfactorily complete a minimum of 520 in-service training hours, of which A, the initial 40 hours can be nothing but observation. So in those first 40 hours, you cannot help in any way, can't touch a patient, can't take a hot pack off a patient. B, the remaining 480 hours shall consist of direct supervision by a supervising chiropractor in the treatment area and must have 103 course hours of instruction from a board-approved provider with a minimum of 24 hours in anatomy and terminology, 3 hours in jurisprudence and risk management, and then 76 hours in physical therapy modalities and indications. There are no waivers, extensions, or exceptions granted except by the majority vote of the board. Now, if you don't meet these requirements, and then you'll be immediately suspended from the applicant training program. Section 10.43.07.06, the term and renewal of registration. Your registration expires every 2 years unless the registration is renewed for a 2-year term. So basically every 2 years it's going to expire, and you're going to need to get continuing education. We'll talk about that down at the bottom of this page. Before the registration expires, you may renew it for another term, so long as A, you're still entitled to be registered, you haven't had any, committed a felony or something. Two, you pay the renewal fee as whatever is current in the current Comar guides. It's 10.43.06. Also, that you've submitted to the board a renewal application on the form that the board requires. So there's a renewal form that when your license comes due. And number 4, submits to the board verification of at least 10 hours of continuing education in courses approved by the board. Now, you can always check back with us because we do offer continuing education for chiropractic assistants, and generally it is very, very affordable. So you can check and make sure that you get your 10 hours online with us. The next section is 10.43.07.07. Chiropractic assistant examinations and application for registration. So if you otherwise qualify for registration and you're entitled to be examined as provided in this regulation, then you're going to be able to take the test. B, you shall pass the board proficiency and jurisprudence examination. And on the day you come to our office for your in-service hours, on that last day, you'll get your certificate that you'll send in to the board to take the test, and you'll also get a summary review of what to study and how to study for the board test. C, you shall, number 1, pay to the board the examination fee, which is always a lot of money, which in my opinion, that's my opinion, I think it's a little much, but it is what it is. And then 2, you'll submit all the fees, your transcripts, the application documentation, and you want to have that documentation postmarked not later than 45 days before the examination date, or guess what? You're not going to be allowed to take the test. 3, you must submit satisfactory evidence of having completed a state and a national criminal history record check, and you have to go online and check for that. Here in Western Maryland, the closest place of having your fingerprints and all the stuff finished for that was Hagerstown, Maryland. D, the board shall, number 1, give examinations to the applicants twice a year, and those times are posted on the Board of Chiropractic Examiners webpage. So you can search on Google Board of Chiropractic Examiners Maryland, and that will take you to the page, and they post that on the page. Number 2, the board will notify each qualified applicant of the time and place of examination, and they will, number 3, determine the subject scope, form, and passing score for the examination. Section E, re-examinations. If you fail the examination, the Board of Chiropractic examination twice, you may retake the examination only if you pay a re-examination fee and you complete an additional 10-hour refresher classroom training course as approved by the board in areas of deficiency. Number 2, an applicant who fails the examination twice may not perform in-service training or direct patient care under the regulations outlined in this in section .3 of this chapter. F, so let me just go over that one a second. So if you fail the examination twice, you cannot do any more patient care. You're finished until you pay the re-examination fee and pass the course and pass the test. So F, the board may not issue a license or registration if the criminal history records information that's required under this regulation hasn't been received. So you got to get your criminal background check finished, or they're not going to issue you a license. Section 10.43.07.08. These are the things that can be performed by a chiropractic assistant. So these activities can be performed by chiropractic applicants and assistants without direct supervision. This means the doctor doesn't have to be looking at what you're doing. So only a chiropractic applicant who's registered or a licensed assistant can do these activities without the direct supervision. A, taking the height, weight, and the vital signs. There's videos on that in the class, and recording them into the patient record. You can assist in dressing or undressing and draping the patient. You can remove and apply assistive and supportive devices. So what are they? You can put on a low back support. You can help them with a orthotic. You can putting an orthotic into a shoe. You can help them with a neck collar, putting a neck collar on, or a wrist splint, something like that. Excuse me. Also, you can observe treatments and modalities as authorized by the supervising chiropractor. You can provide pre-printed, non-patient specific health and chiropractic concepts type of information that has been approved and reviewed by the supervising chiropractor. So what does that mean? That would be like you can give a patient pre-printed thing about headaches. Here's a brochure we have about headaches, and it's got all that stuff in it. Here's a brochure about neck pain. Here's a brochure about spinal decompression. You can do that. And you can also take patient histories. Now, when you watch the patient history videos that are part of this class, I've used ones from Nurse Practitioner links because they're very thorough. Now, obviously, you're not going to be asking the same kind of questions on your patient histories. Your doctor will let you know, here's what I want in my history. The reason I use these videos is because they're very good at letting you know the process. What kind of questions, how you should talk, the tone of voice, how do you make somebody feel comfortable. So that's why they're there. The concept is the same. The questions may be a little different, but the thing is, some chiropractors may use all types of physical therapy and have a very broad kind of practice for many different problems. And their type of history is going to be extremely different than a chiropractor who maybe only does neck adjustments, and the only therapy you're ever going to do is neck traction. And that happens. So instead of trying to give you, here's how you do a chiropractic practice, because that's impossible, I want you to get the concept of here's how it's done. This is the theory behind doing it. All right. Next section, 10.43.07.09. These activities may be performed by chiropractic applicants and assistants under direct supervision of a supervising chiropractor. So you can do these activities only under the direct supervision of a supervising chiropractor who is in the treatment area. Functional activities of daily living and hygiene. This would be things like, how to get up out of a chair, how to get in and out of the car, how to get a bath if your back's really hurting you and you can't move very well. Gait practice and ambulation, better ways of walking, and I have correct ways of walking. So there's a video on that as well. Also, demonstrate and be able to do demonstration, administration, and observation of therapeutic exercises as prescribed by a supervising chiropractor. So your chiropractor may give some exercises and some stretches for the lower back, and you can do that under direct supervision. You can assist in moving a patient within the treatment area. So that would be somebody that maybe they're using a cane, maybe they're in a wheelchair, maybe they need to use a walker, maybe they just need somebody to lean on. So you can do that. Contrast baths, hot and cold packs, Hubbard tank, which is basically like a big whirlpool tank. Different types of light therapy, infrared, ultraviolet, non-laser light therapy, and therapeutic laser, not heat-producing laser. Muscle stimulation, electrical muscle stimulation, the low-volt stimulation. Electrotherapy, interferential, those type of things. And all these will be talked about. Paraffin baths, traction therapy, ultrasound, whirlpool, diathermy. Therapeutic massage, if you're also licensed under the massage section of the Health Occupations Annotated Code of Maryland 3-5A.01. In other words, if you're also a massage therapist. Otherwise, you could do vibratory massage, but not therapeutic massage. You can do mechanical or computerized examination procedures for the sole purpose of collecting data. So if these conditions are met, one, that the data will later be used and interpreted by the chiropractor to form a diagnosis, because as a chiropractic assistant, you cannot form a diagnosis and you can't talk to a patient about their diagnosis. And number two, no test can be performed that requires diagnosis or interpretation as part of the data collecting. So things that you're just taking pictures for posture analysis, or you're taking pictures for computerized range of motion. So long as you're taking the pictures, you may be taking the pictures and clicking on the dots, but you're not going to be interpreting that range of motion is deficient. So you're not going to tell the patient, wow, your range of motion is terrible. Section 10.43.07.10, chiropractic applicant or assistant prohibited acts. These are things you cannot do as an assistant or an applicant. Can't do these things. You can't talk to a patient about their evaluation findings or their diagnosis. Okay, you can't talk to them about that. Don't tell a patient, well, the doctor has put down that you have cancer, or even something as simple as the doctor's put down you have bad posture. Can't talk to them about that. You can't perform an act that requires professional skill or judgment of a licensed chiropractor. So basically, don't try to adjust somebody. All right, don't try to do something that, like, or you're going to go back and do dry needling on the patient. C, you can't take x-rays. You can't even position the person for the x-ray. So you can't take the person in, take an x-ray. Now, at the very bottom of this class, you'll see x-ray positioning on my page. And the reason that that's there is it's also for your doctor if they want to review it. But this class is open for people in other states to look at as well. And in some states, chiropractic assistants can take x-rays with a little additional training, and they can position people. So Maryland is an exception, and in Maryland you cannot do that. You also cannot perform orthopedic or neurological tests. Can't check people's reflexes. Can't do cervical compression tests or any orthopedic or neuro tests. That's out of bounds. You cannot engage in dietary or nutritional advice or counseling. So you can't tell a patient, look, your bones look light on those x-rays. You need to take some calcium and some vitamin D. Can't do that. Other acts not within the chiropractic applicant or assistant's specified scope. So anything else that's not in the scope can't do. So can't do surgery. All right. Now, section 10.43.07.11. You cannot practice without registration. Now, this is a real license and it's serious stuff. So if you don't have your license or it expires and you don't have the money to renew it or whatever, then do not practice your chiropractic assistant profession. Except as otherwise provided in this chapter, a person may not practice, attempt to practice, or offer to practice as a chiropractic assistant in Maryland unless they're registered by the board. You also may not serve as a chiropractic applicant or assistant unless you're approved by the board to begin training. So the penalties for violation of this chapter. If you violate the stuff that we've talked about, then it can result in disciplinary action against the supervising chiropractor as set forth in section 3-313. If you also violate the chapter, then on B, you'll see that a person practicing as a chiropractic assistant without being registered, except as provided in these regulations, is guilty of a misdemeanor, and they can be fined $5,000 or imprisoned for 1 year or both. So this is serious. If you do something outside of the scope, you're going to be fined or could be fined $5,000, and you could even get a year in jail. C, a chiropractic assistant and an applicant for registration is subject to the board's disciplinary authority under Health Occupations Article 3-313. Section 10.43.07.13. You must display your registration or your license. A chiropractic assistant shall display, this is after you pass the board, shall display the registration and any current renewal registration in an area where it can be easily seen. So this includes a temporary space, or even if it's in an exhibit location. If you're doing any, like maybe you're doing vibratory massage at a health fair, you must take your license with you. All right, if you're outside the office doing something. In the last section, 10.43.07.14, if you change your address, if you're a registered chiropractic assistant, you must notify the board of any change in the name. So if you get married, you change your name from Smith to Jones, you must notify the board, or the address of the chiropractic assistant in writing within 60 days after the change occurs. All right, so make sure you watch the rest of the videos in jurisprudence and boundary issues and negligence and things like that, and then make sure you've reviewed the documentation, which you should have done before this. Now, there's other things if you choose to, which would be a good idea, is go back and go to the Board of Chiropractic Examiners website and look at all the Comar regulations, including that pertain to chiropractic, so that you're familiar with not only the ones for you, but also the stuff that your chiropractor is doing. Because there are some things, like, for example, if let's say that your chiropractor goes to lunch, comes back after lunch to see patients, and he reeks of alcohol. That's something that you may need to report to the Board of Chiropractic. So here's another thing just that pertains. Let's say that patient has electrical stim on their order to be performed, electrical stim on their shoulder. And you know because you did the history that the patient, and it's in their chart, that the patient has a pacemaker. Well, that's a very important contraindication, that the patient has a pacemaker, but the doctor says he wants electrical stim on the shoulder. So you go back to the doctor and you say, look, this patient has a stimulator, pacemaker, and you have electrical stim. And he goes, I don't care, put that on there. Go ahead and put it on. You do not have to do that. You are a licensed professional. If that's a contraindication, you can tell the doctor, look, if you want to do it, go ahead, but I'm not doing it because it's a contraindication. So, you have the right and you have the responsibility to make sure that as a licensed professional that you are, number one, looking out for the safety of the patient first. All right, that's where even though it's your job that you're working for this doctor, your job is the safety of the patient. So always keep that at the top of your mind, and you'll be fine. Your main responsibility as a licensed professional in the state of Maryland is the safety of the patient and the well-being of the patient. All right, if you have any questions, feel free to give me a call.